Hello, my name's Andy. I'm one of the partners at Ashtree Surgery in Carnforth. I'm a GP and I'm also the lead for health and wellbeing here in North Lancashire and working around Morecambe Bay. And one of the things that I'm really interested in my work right now is how we create the kind of culture within the NHS that builds really happy, healthy, well, resilient teams who are able to carry on providing the kind of care that we would love to see provided within the NHS. And we haven't historically been brilliant at looking after our teams. We've spent a lot of energy and focus on really trying to give brilliant care for patients, but actually when you don't look after your teams, actually your care of patients begins to slip as well. So we need to go about some cultural change in the NHS, and I've been looking at the 5 ways to well-being from the New Economics Foundation to try and understand how we could create a different kind of culture within the NHS. And the first one I've looked at was the need for us to connect. Secondly, the need for us to be active. Thirdly, the need for us to take notice. And fourthly, the need now for us to keep learning. One of the things that the King's Fund talks about is in terms of the cultures that we need to see within the NHS is that we need to have teams that are continually improving. And actually, if you don't have a culture where teams can keep learning together, we're not going to keep on improving. And if you look at how much new guidance there is for nursing teams, for doctors, for midwifery teams, for therapists across the board, over in just the last couple of years, it's kind of an exponential curve. It's just unbelievable amounts of more stuff that we need to know, new things that we need to keep up to date with. And unfortunately, our lives have become so jam-packed and so busy, creating environments where there's protected space for us to learn together has become pretty impossible. So there's something about us taking ownership of that and actually not being afraid to put up some barriers, some boundaries, sometimes with the public, with our patients, to say, you know what, we have to close now, we have to create some space so that we can learn, so that we can really improve ourselves and make sure that we are taking care of our knowledge and taking care of our relationships so that we can provide excellent care. So it's not an easy one, and actually sometimes it's easier for hospital trusts than it is for those of us working out in communities, because time is less easy to protect in some ways. But we've got to own it as part of our culture, that we need to be organisations that are learning, and there's a challenge for us to work out how to do that, and there are some conversations we need to have to get creative. But actually, if we're going to have a workforce, we're going to have staff who are happy, who are healthy and who are well, we have to keep learning, and that means we need to have protected space. One of the terrible things that's happened with appraisals, they started out as potentially a really brilliant idea as a way for GPs, for nurses, for hospital doctors to keep on top of some of the new guidance and new targets that get thrown at us all the time, and actually for us to be lifelong learners who are able to adapt our learning according to what we recognise our needs to be, and to keep that as a very healthy process. But unfortunately, it's become such a tick box exercise. It's become very target driven, and it's really lost its way. And if we could recover what appraisal could be, and give it an opportunity where that's built into our working life pattern, not squeezed into the end of a 12 or 14 hour day where we're really tired and no one wants or has the energy to be reflective after such a day. Actually, we need to understand how important it is. And so we need to build it into our organisations, put some barriers up and say, you know what, sorry, whatever else the pressures are, we have to be an organisation that keeps learning, because otherwise the care that we provide is not going to be very safe, and the teams that we are trying to provide that care through are not going to be very happy. So it's a challenge, but as part of having resilient and not just resilient teams, but teams that really flourish, we need to think about how we can be organisations that keep learning.